Good morning, everybody. Scott Maybor here with your Medicare Missive from the pond for Tuesday, the 16th of June. Beautiful day. Hope you're all enjoying it. Today I want to talk about drug plans. Got an email yesterday from a client, and she says, I got a letter from my drug plan carrier, so in this case Blue Cross, that she needs to prove her drug coverage from 2017 all the way to 2025 to avoid the penalty. And she goes on to say, I'm not sure why I would need to provide the information since drug coverage is optional. Drug coverage is not optional. So since George Bush 2, drug coverage is mandatory. If you are over 65 years old, you must have drug coverage, period. Doesn't have to come from a Part D carrier. It could come from an employer's plan. It could come from a spouse's employer's plan. But the rule is you have to have creditable, quote unquote, drug coverage that is as good or better than what Medicare would offer. In this woman's case, she had come to me. She had already signed up for A and B. She already had it. She asked me to sign her up, help her choose a drug plan and an Advantage, and a Medigap plan. I assumed she had had drug coverage. I asked her, I assume, she was working still. Do you still have, you have drug coverage from work? Yep. Okay, great. But when she applied for Medicare, she never proved her coverage. So now that she's applied for a drug plan, they're asking for proof of coverage to avoid a penalty, which is going back almost 10 years, 9 years of penalty. And the way the penalty works, it's 1% per year, per month for every month you missed, and that 1% is calculated on the national average cost of a drug plan, which is around $35 a month. So in her case, she doesn't take any medications. Drug plan's $8 a month. She's going to pay way more than that in the penalty. Her $8 a month drug plan will cost her about $65 a month. She has 4 options that I gave her. One, she continues with no drug coverage. If you don't have a drug plan, they don't charge you the penalty. So in her case, she could cancel the drug plan. She doesn't have any drugs. The penalty will still accrue so that if she applies in a year or two, it's going to be that much higher, but she wouldn't have to pay the penalty. 2, she qualifies for some sort of government assistance. That could be anything from your state's pharmaceutical assistance to LIS to full Medicaid. Any type of assistance disqualifies you from paying the penalty. So if she qualifies for assistance, she won't pay the penalty. She could submit the proof, and that way it'll take a while, and she'll have to go after them for what she overpaid because of the penalty. But she can track down the penalty, the information. The problem is she's had multiple employers in the last 9 years. How is she going to prove that she's had coverage at this employer that may not even exist anymore, and then this one, and this one, and this one? It's complicated. It's a pain in the neck. I tell clients, even if you're not going on Medicare, but you're thinking, I had a client whose company may be getting acquired soon. I said, have somebody sign off on the form for Medicare that you've had coverage since you turned 65, because who knows what it's going to be like when the new company takes over. It may be very hard to prove that you had coverage from the previous employer who was swallowed up and no longer exists. Her 4th option is to simply pay the fee. And none of those options are necessarily great. The best one is to get the proof, but that's going to take some work, and she wasn't really thrilled about doing that. But just so you know, just to be clear, Medicare Part D, or drug coverage, let me put it that way, drug coverage is required if you're over 65. It doesn't have to be a Medicare drug plan, but you do need drug coverage. If you don't, in the future, if you opt to not have any drug coverage because you don't take any drugs, and I see that a lot, healthy people who don't take any drugs say, well, why buy a drug plan? I'll get it when I need it. Doesn't work that way. If you're 65, you need to have drug coverage. If you don't have drug coverage, when you do eventually sign up, and that's the kicker, if you never sign up for a drug plan, you just pay cash for the rest of your life. You buy them from Canada, you buy them from Amazon, you buy them from Mark Cuban, wherever you can get the drugs cheaper. And I've had people who, they were immigrants. They go back to their home country and buy drugs. They're much, much cheaper outside of the U.S. You can certainly do that, and you'll never be penalized. But if you ever sign up for a drug plan in the future, you will be penalized for 12% a year for every year you missed. Let me know if you have any questions. Happy to answer them. But if you are over 65, make sure you have creditable drug coverage. Have a great day, everyone. Thanks for watching. Be well, and tell your friends.